Thinking about cosmetic surgery abroad, but not sure who to trust. Most people who had bad experiences didn't choose the wrong country. They just didn't know what to look for. Our team visited our partnered surgeons and hospitals in person. And here are the 5 things you need to check before you book.
Hi, my name is Murillo. I'm plastic surgeon here in Cali, Colombia. I did my studies of medicine in Brazil, also my training in plastic surgery in Brazil. Since then, I have been working in many places. In the United States, I was professor at Louisiana State University. Also, I did some work in French Guiana and in Mexico.
Hello, my name is Im Young-min, Dr. IM. My career is a 22 years experience. I'm a board certified plastic surgeon. And then my specialty is face and body, all kinds of surgery, many experience. So, and then I'm very interested with the total face remodeling, and then interest with anti-aging, include the facelift and neck lift. Yes, becoming too young face, right? Okay.
My name is Carlos Verkalis. Yeah, this is Lithuanian clinic, one of the largest in Baltic countries. But I'm also working not only in cosmetic surgery. I'm also specialist in reconstructive surgery in our public hospital, but I have my license as a fully certified plastic surgeon 2 years already, so it's my 2nd year. And my main say expertise, where I'm best at, my biggest interest is in aesthetic surgery, is body contouring surgery. So mostly patients after weight loss, after massive weight loss, post-bariatric patients, but also all big variety of patients.
He is Dr. Tanong Sapanyavaro. He is the best doctor here. He is the principal doctor, and also he is the owner of the hospital as well.
Oh.
He is American born plastic surgeons. He can do from head to toes, and he got the dream teams, about 15 doctors for him. He is trained in Canada, Halifax. He is certificate in North America, and also he is a ASPS member and ISBPS as well. So he can speak English, well, Thai definitely native, and some of the Japanese as well. At first, the patient can send the photo and all the document, the test to our email center, and then they gonna send it to the doctor to review and give the treatment plan. And then we gonna give the estimate cost. And after the patient accept to do, after fly in to Bangkok, we have the transportation service to pick up the patient from the airport to the hotel, and from the hotel to the hospital. Also on the way back to the airport, we have the airport drop off.
In our clinic, we are doing basically 5 types of tummy tucks. Yeah, so we have mini tummy tuck, which is small incision. We are not changing the belly button position. Basically, we are removing only the lower part of the tummy. We are not correcting the muscle. If we have muscle separation, it's not corrected. Then we have the classical tummy tuck, which we all know very good when we have incision from hip bone to hip bone. When we are opening and dissecting all the tummy up to the xiphoid bone, chest bone, we are correcting the diastasis if necessary, or fixing the abdominal muscle, tummy muscle laxity. We are changing the position of the, not position, basically we are making a new opening for the belly button, and that's the classical tummy tuck. The most popular procedure that we are doing in our clinic is extended tummy tuck. It's longer incision that goes all the way to the back, but not connecting. So we are addressing frontal area of the tummy, which is usually very loose. We are changing the flanks, which again, patients after massive weight loss, they have problem not only in the frontal area, but also in the flanks. So extended tummy tuck helps to correct both frontal view and side view. During this procedure, so we have the regular tummy tuck with all the dissection, with up to the xiphoid bone, muscle repair, plus we turning the patient on their tummy and we starting the surgery from the back. We are removing the flanks, the like skin, fat, other tissues, then returning around and doing the final tummy tuck. And of course, we have 360 tummy tuck. Basically, 360 tummy tucks are what we are doing. We are dividing depending on the patient's needs. This can be lower body lift when we are doing thigh lift and buttock lift on the same procedure and removing excess skin and fat, or it can be belt lipectomy, especially for patients who lost 50, 60 kgs of weight. So they have laxity all around the body, and we are addressing everything. We are starting from the back and then turning the patient around on their back and doing the tummy. So this is, after these procedures, after the tummy tucks, patients are staying for 2 nights in our clinic.
When you talk about liposuction, the name says suction, and lipo means fat and suction fat. But when you talk about liposculpture, it means that you harvest fat from one side and put it in another side. For instance, for buttock augmentation. By the way, the first paper talking about how does the fat behave after being injected in the buttock. The first study looking with images, how does it work, was mine. And that was the first in the world.
My main expertise and what I'm best at is breast surgery and anti-aging facial surgery. Facial surgery was popular before, but nowadays many patients want to have beautiful body shape more and more. The most important part of beautiful body shape is breast. For safe breast surgery, the safe surgical method and implant are important. There are various types of breast implants, and we recommend patients the best implants depend on the patient's ideal shape and safety.
The first time, the customer want to do the facelift here. Okay, but to do the medical. Yeah, must to send me the medical form first, and I see everything. When I see the medical form, I know about the customer health. And I ask the doctor or the anesthesia doctor first, and after that, when can do, she can come here and see me, and after that do the blood test, write everything, and see the doctor anesthesia first, and after that the hair is good, we can do. we can do a mini facelift, a smart facelift, and deep blend facelift. Deep blend facelift when so the patient had the big face and sometimes had a lot of wrinkle in the skin, but it's dropped down, sagging, sagging. Yeah, there are things sagging a lot, and not much to do the deep blend facelift. Oh, okay. But the customer younger a little bit, and the wrinkle here, not a lot of wrinkle, they can do mini facelift. If the patient come a lot of wrinkle in the face, a little in the skin, and I think a smart facelift is better. It depends the customer. The facelift we cut the scar around the ear up inside the hair and low inside the hair, and the scar you don't see at the format.
Recovery is a critical part of the plastic surgery process. For facial cosmetic surgery procedures, we'll generally recommend that you keep your head of bed elevated and use plenty of ice the first several days. For procedures in the breasts and body, we've got specialized compression garments that you'll wear and estheticians that'll work with specialized post-operative therapies to optimize your swelling and facilitate your recovery.
It's important for you to know that the results are not immediate, and the final result will be seen after the edema is completely gone.
It's also important to acknowledge the emotional process involved in healing from plastic surgery. We've got a whole team of professionals here to focus on you to get you better as quickly as possible.
My name is Ivana Naleo. I find that perfect clinic from the Instagram.
I have a blepharoplasty up and down and over on my nose.
I'm so happy, I'm so exciting before, and I think it's so pain, but couldn't pay nothing. The team and excellent service is so grateful.
I stay only a few days and I'm ready to back to London. I'm so happy and I recommend so much for 5-star for that. All service, all beauty team is really good.
Hi, my name is Amy Lehia, and I saw Dr. Munez close to Christmas this year. He said that was his Christmas gift, but I think he was mine. Down in Tijuana, Mexico. Drove down from San Jose, California, and I really would like everybody to know how much of a blessing it is to be able to come to Mexico. The care that you get here is amazing. The surgeon is Dr. Munez is amazing. The care that he gave me throughout my time here, he visited me even when I was staying in a hotel, just made me very, very comfortable. And I would tell all of my friends and family that if you have the opportunity to come to Mexico and have any surgeries, I've done the gastric sleeve, and then this time I did the mommy makeover. And it's just every time is the best care. And Dr. Munez and Hospital Angeles was amazing. So, yeah, that's it.
You now know what most people only wish they'd known before they booked.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.